I don't know why this is in medicine in the United States, but why in ophthalmology, we're like the one field where we have medical insurance and vision. Vision insurance confuses patients. They don't realize that's optical, that's glasses, contacts. They don't know if their eye is red, that's their medical insurance. So some people, I don't have vision insurance, I can't see an ophthalmologist. So they go to ER. And it's like, no, like that's totally under your medical insurance, but they don't know that.
Welcome to Healthcare Liberty Labs with Tiffany Ryder, where we teach you what they don't want you to know about healthcare.
You know, you're in ophthalmology. I honestly didn't even know that PAs could practice in ophthalmology.
It's the most common thing I hear.
Yeah, I bet. I bet that is not original. I did a little bit of research and it looks like there's less than 100 PAs in ophthalmology worldwide. That's still true?
That's still true. I created like a group of us and there's about 80 or so, give or take, in that group. So not very many of us around the world now.
Yeah, it's really neat. So, I think like what's particularly interesting is that medicine tends to be a really regimented, highly regulated, we do things this way and we've always done them this way kind of place. So really to forge your own way and find your place in the midst of that environment, I think is really unique. I actually heard an interview that you had done on someone else's podcast, I think it was, and you were talking about how you really are a specialist in this one very narrow, what we think of as very narrow area, but that one of the reasons that you feel so passionate about it is because to you, it doesn't feel like a narrow area. It's an indication of so many things.
Absolutely. I light up about this. And when I'm talking to students, lecturing, or with patients, it's so much more than glasses and contacts. I mean, I don't even do that. That's optometry. I mean, I love like the cliche saying, eye, the window of the soul, but it really is real. And that's what I found as a pre-PA when I had this imagination of medicine. I want to do this, but I've never actually done it. How do I know if I like it? I was able to see these patients and be like, whoa, your eyes told us you had this other systemic thing going on. So cool. And I fell in love with the pathology and its relationship with the body, but also just the emotional and artistry aspect of the eye. They're so cool. They're very emotive organs. We communicate them and you have to gaze in eye contact and human interaction. So it's just a moment of shared connection with just a fellow human being. That's how I view it. And it's almost like I get to go look into your eye and let's see what I find and let's see what I learn about you beyond what maybe you come looking like presenting with. And I think that's such a moment for just all humans. You want to be seen for who you are, not for what you produce or what you look like or how you're perceived. And ophthalmology for me, I really found like was the marriage of like the left side of my brain and the right side. And that's how I found it within medicine. Yeah.
It's so cool. It's almost like a spiritual reckoning, right? Like,
yeah, a little bit. I mean, it's kind of nerdy. Maybe other people are like, okay, who's this guy talking? But for me, that's really how I view it. I mean, I have people all different walks of life and different cultures and races, but none of that really matters when you get to gaze into their eyes and you see really their heart behind who they are. And sometimes literally, if it's a heart condition or a coronary artery disease that's affecting their eyes. But yeah, I've diagnosed many systemic conditions and have saved many lives from an eye exam. So it's more than just waking up and helping. I mean, it's really rewarding to prevent blindness or give someone's vision back. Like that never gets boring, but to be able to be like, oh, I just saved your life. Like, whoa, this is cool. This is cool work. Yeah.
Yeah. It's so awesome. And I mean, that's the person that I want looking in my eyes. Right?
Yeah.
I want the person who's excited about that.
Yeah.
So I love the part of your story, probably more than you do, about how you were being told no and no and no. And, your bills selfishly still wanted to be paid, despite the fact that you hadn't found your dream job. And instead of saying, well, I guess ophthalmology is not for me, move on, right? You said, okay, the season is not for me in ophthalmology. I will spend this season doing something else while I'm building the life that I want to have. So tell me more about, how did you end up in family medicine? Why family medicine and not ortho?
Yeah.
And then how did you get out of it and then actually start this consulting business that you're engaged in?
Okay. So my PA program, we had to do family medicine the whole year. It's a lot different than other programs. You're assigned a community and you are in family medicine 2 or 3 days of the week for the whole year, not just 6 weeks next rotation. And then the other days of the week, that's when you're doing your other rotations. I fell in love with that concept because I actually felt like I got to see patients back. In family medicine, it's, see a patient and okay, come back in 3 months. As a student, you're not seeing them. You're gone on your next rotation. So through that year, I was assigned this clinic. Well, as we've talked about networking, who am I also getting to know for a year? The entire employees, and it's a private practice. So when I was working there for a year, I became very familiar with the EMR, the patient's load, all the people I'd be working with. And they, as we also mentioned, and a huge thing I realized going through PA school is PA school is honestly all about clinical year, and they're all job interviews is the way I look at rotations.
Yeah.
And so I had a job interview before I left. Like, you've been here a year. You already know how this, I basically gave them work for free for a year. And so they were like, come work with us. And so when I graduated and was getting those no's, like you said, well, I need to start my career. I can't just sit around and wait for it to happen. So let me find a job that I feel I can go to, that as I look to, build this ophthalmology thing. And for me, that was the safest option because I knew the people, I knew the EMR, I knew the patients, I knew what I was signing up for, but I also knew they knew my passion. I never hid it from them. They knew very well. I'm like, I like ophthalmology. That's what I'm going to do. So yes, I'm working there for 9 months. I'm getting to work with people I already like. Did I like the medicine as my personal experience with it? No, I did not know what burnout was. And that was when I learned what it was. Which is interesting as a new grad, you should be excited and happy. And I was not realizing the physical manifestations of burnout. I was not sleeping. It was not a good fit for me. And so I'm thankful to have gone through those 9 months, because now if without it, I don't know if I would be able to recognize what burnout is, or I don't know if I would have strong tools to implement without that experience. But in that experience, when I approached them and said, hey, I know it's only been 9 months, but I'm leaving. I found ophthalmology. They were clapping. Go do what you're passionate about. We know you love that. Go do it. So that's why I picked it. It was people that I knew. I went back to the relationships I had. It wasn't, oh, let's go do ortho and join a group I have no clue and I'm not passionate about. I'm not doing the work I'm passionate about anyway. So I might as well work with people I actually enjoy.
Yeah.
That was kind of my decision process behind it. While I every day would spend time interviewing.
Yeah. That's funny.
Yeah.
That's essentially how I decided what specialty I liked as well. I went in thinking that I was going to go into psychiatry or pediatrics. I went through each rotation and I thought, this is a job interview. I've got 5 weeks to get this job. And to my surprise, I loved all of my rotations.
Same.
So, right?
Same.
So every time I would go in, I would be like, oh, these people are great. This medicine is interesting. These patients are lovely. And then I was like, well, I love that. What's next? And then I would get to what's next, and I loved that just as much.
I know. And I'm like, I can't narrow this down.
And you're like, what a problem to have. But at the same time, I was like, oh my gosh. So for me, it really came down to, like you said, it was like, well, where's the group where I felt like I didn't have to smile and nod ever, right? Like I walked in the department and people were like, hey, dude. And it felt like I was hanging out with like my college buddies. And that's essentially how I end up in emergency medicine, because they said the F word more than everyone else did. And I said, I must be here. I certainly enjoy emergency medicine, but I wasn't like, oh, this is the only medicine I can do. Yeah. So I think that is a good lesson for, people who are looking for their way, is that maybe it isn't exactly clear what that passion is. And if that's the case,
ask yourself other questions about it. Like, well, do you like your coworkers? Do you get along? Do you feel like you're being hovered over at work? Or do you have this underlying fear of like the work and someone's watching? Like, those aren't good feelings. Do you feel you'll go in and be yourself and you have fun? Great.
Like, if you're not sure where you fit, then probably not going somewhere very specialized and very specific, right? Like going somewhere where you can get a good grasp of several different fields and specialties and decide where you belong, I think is probably a good rule of thumb.
This episode brought to you by Crowd Health. Crowd Health helps you find awesome doctors, negotiate your bills, and fund those bills through our peer-to-peer funding platform for less. Welcome to an easier way to pay for healthcare.
And of course, I couldn't let Joel go without discussing a little bit of ophthalmology and how it pertains to health insurance in the ER.
I don't know why this is in medicine in the United States, but why in ophthalmology, we're like the one field where we have medical insurance and vision. And vision insurance confuses patients. They don't realize that's optical, that's glasses, contacts. They don't know if their eye is red, that's their medical insurance. So some people, I don't have vision insurance, I can't see an ophthalmologist. So they go to ER. And it's like, no, like that's totally under your medical insurance, but they don't know that.
Honestly, that's something I never even thought about, right? Like the insurance thing, and that someone might think, oh, well, I don't have vision, but I have medical, so let me go here.
Yep.
I have found in my experience that I have patients on a regular basis who do not have established care. And if I literally just Google ophthalmology and the address of the emergency department I am currently practicing in, I can usually get someone on the phone. And that person usually says, look, if you can get them here in the next 20 minutes, we'll see them. Is that your experience on the West Coast?
I love that you bring that up. It is one thing I'm really proud of. I will say consistent across board. Most people say like, oh, ophthalmology, you guys are so nice. Like a lot of ER urgent care, they're like, I love going ophthalmology because they never say no. And they're always
they never
like,
yell at you.
Yeah. Like,
they take care of your patients.
Yeah. Because honestly, one, I think all of us are really happy. We enjoy our field and we have really good work-life balance within ophthalmology. So I think we're just in better moods, like as a general, like receiving that call. But two, we know like, yeah, what are you guys going to like just we'll see them. And it is a simple Google search, but if your patient can't see to pull up this, there's so many barriers. I think it's really eye-opening to realize patients' vision impacts so much of their life. And patients will say that you didn't give me my vision back, you gave me my life back, because they can't do certain things they used to do if they can't see to do it. And there's a lot of barriers to care with patients. And I think that's why they're going to you all. Yeah. And how do we prevent that when now we're talking social risk factors and all these other risk factors that can we control that? But at the end of the day, if you're an ER urgent care provider and you're seeing something in the eyes, I'd say across the board, if you ever just not sure, just send them to opto. 9 out of 10, they're going to be like, yeah, happy to see them.
Yeah.
But how do we reduce those visits? That's hard.
It's a great question, right? So if I were to have an eye complaint of any flavor that I thought necessitated an emergency room visit, me personally, I would have someone drive me to the emergency room. And while I was in the car, I would be on the phone with whatever ophthalmology practice I could find to dial. Is that what you would recommend or what do you?
Yeah, I would say if you don't have established care within an ophthalmology clinic, let's say you're not a patient of an eye clinic and you have this really emergent situation with your eyes, whether you have sudden loss of vision or excruciating pain. Yes, work your way towards an urgent care or ER, but bring someone with you because you're probably going to be dilated. So you're going to need someone to drive you anyways, or they might do a procedure, or you can't see to drive. So bring someone with you, but really try to find on your own advocacy an eye clinic who you can establish care with. If you have established care with an eye clinic, honestly, I would call them before you go to the ER because even if it's after hours, every eye clinic is going to have an on-call ophthalmologist that's staffed from that clinic. So you're going to be able to get a hold of someone that's no different than your PA ER provider calling that on-call ophthalmologist. It's the only difference is you're the one doing it versus a provider, right?
Right.
But it's the same phone call that you're making. And so if you have an eye clinic established, don't hesitate to reach out to them first, even if it's after hours, because there's going to be someone who's going to take your call. So I would do that. I would base it more triage like that. Are you established patient in my clinic? Well, yes or no, and then go down from there.
Yeah. That's also a really great point because, I do have patients who say, oh, I didn't know that I could call this person. I didn't know someone would be covering for my doctor. They're on vacation or what have you. And a lot of times we're just saying like, well, yes, of course. And I'll call for you. Right. But the patient could have potentially called the 4 hours they were waiting in the waiting room as well. Yep. So as we're wrapping up, how can people reach out to you? How can they follow you? How can they find out more about ophthalmology?
Yeah, I'd say fastest way, because it shows all the links to everything else, is just my website. So www.joelciolek.com. That's JOEL. And my last name is CIOLEK.com. That will bring up the website on there. It has links to my Instagram and link to my email, where you can send me an email as well. And so people can find me through that way and send me an email about if you want to meet or just have a general question, or if you're a professional out there and just questions about the podcast, what we talked about. Yeah.
All right, perfect. And are you available to do guest lectures, virtually for PA programs,
Yes.
things like that?
Yeah. So I teach locally here in the Bay Area, California, but I do teach virtually to programs on the East Coast as well.
Okay.
And I've been doing that for a long time now. So happy to connect to other PA programs out there who want someone to teach their eye content. Yeah.
Yeah. Sounds awesome. All right,
Yeah,
Joel. Well, it was lovely having you on.
Thanks, Tiffany. I appreciate your energy and inviting me and just all the work we're doing. It's fun to connect to someone who thinks outside the blocks too.
This has been the Healthcare Liberty Lab. Thank you to our listeners and our sponsor, Crowd Health, for making this possible. Be sure to subscribe wherever you listen to your podcast, be it Substack, YouTube, Spotify, Apple, or somewhere else. We're glad to have you with us on this mission to rethink healthcare together.